Welcome, everyone. My name is Jessica Desjardins. I am a program coordinator in the Office of Community Engagement. If this is your first time joining us, thank you so much for being here. We are glad to have you join us. And if you've been here before, thank you for continuing to support our work and our partners. Please note that this session is being recorded, and please be sure that you are muted throughout the presentation. We encourage everyone to use the chat bar to share comments or questions for our guests at any time. This monthly series features community partners and the important work they are doing. We highlight their goals, motivations, and accomplishments, and the ways they have partnered with people and programs at MCW. I would like to introduce Sarah O'Connor, Program Director in the Office of Community Engagement, who will say a few words about our featured guest. Sarah?
Thank you, Jessica. Welcome, everyone, again. I have the pleasure of introducing our featured guest and facilitator. So first, I am so pleased to introduce Toni Whitaker as our featured guest today. Ms. Whitaker is a certified full-spectrum birth doula and mental health first aid instructor. She is here today in her capacity as the founder and executive director of Sawubona Enterprises. That's a Milwaukee-based nonprofit that serves birthing persons and their community families. She is a passionate curator of learning and growth experiences that provoke deep thought and meaningful engagement. As an award-winning champion of equity, diversity, inclusion, and belonging, she is dedicated to fostering understanding and connection in every space she enters. So thank you, Toni, for being our featured guest today. And I would also like to welcome today's facilitator, Dr. Jessica Olson. Dr. Olson is an associate professor in the MCW Institute for Health and Equity. Her research is dedicated to leveraging and integrating the strengths of basic, clinical, and community research to reduce disparities in cancer incidence and mortality. Thank you, Dr. Olson, for serving as our spotlight facilitator. I now turn it over to you.
Thank you so much. I have the honor of facilitating this conversation today. For some of you, I'm not going to be telling you anything you don't already know about our incredible speaker. But I have the honor of going about a decade back with Ms. Whitaker. And I think that friendship and co-mentorship has truly resulted in some beautiful things, some you'll hear about today. But this amazing person has been such a guiding light for researchers, for staff, for community members. I have the honor of working alongside her in the state of Wisconsin's Maternal Health Innovation Project. We are doing beautiful video projects to show people the strengths in our community. She's been a deep influence on my own grant writing. Anytime I want to fill something with a figure, I've got Toni's voice in my ear, reminding me to keep the voice, the pictures, the people in my writing. She is in bold spaces, especially in times where we need it most. Toni is creating connections. She has facilitated an amazing series called Courageous Conversations. I welcome you to check that out. She's done NCBI training. She's been in spaces where people are grappling with difficult issues and trying to help them come up with innovative solutions. I want to pause for a moment and let her greet you, and then I cannot wait to highlight just this beautiful work that she's doing within Sawubona. So, Toni, you want to say hello, and then we'll get to some questions?
Absolutely. Listen, I'm trying not to cry today, y'all. Like, honestly, come on, Jess. Can y'all hear me okay? Thumbs up. Let me know. Okay, cool. First of all, welcome everybody. We're going to do something together in a moment, but I just want to give a mad shout out to the Office of Community Engagement. Can we just show them some love? Because trying to get people together monthly is not an easy task. And I so appreciate this moment and others that I've attended, learning about the amazing organizations that many of you might work with or might know about, and supporting our nonprofit organizations, our small organizations, our community. We know that means so much to them. So shout out to Jessica, Sarah, Jai, Dr. Young, you all. I truly, truly appreciate you. Real talk. All right. So as a community, we know that things can feel heavy. We honor that. So here's what I want us to do together before we start to talk about why we came here, y'all. I want us to greet each other in this space. Sawubona means I see you in South Africa. It's a common greeting that they use there. So I want us to all greet each other because I truly believe the greeting is one of the most powerful things we can do. And it's so simple. So let's do that right now. We're going to unmute. I'm going to count us down. And it's okay if you don't say it right, but Sawubona, practice it a couple of times. Okay? No judgment zone here. And then we're going to I want to hear your voices for a moment. So count us down. 3, 2, 1, unmute. Sawubona.
Sawubona.
Oh, y'all sound so good. Yes, I love it. Thank you so much. And then I also want to do one more thing because I'm a quote girl. I love quotes that inspire me, especially during tough times. So throw in the chat a quote that you all might be leaning on right now. Maybe it's something your grandmother told you. Maybe it's something someone mentioned to you yesterday. Think about a quote that just fills your heart when you need that extra oomph. Y'all didn't know these questions was coming, so don't worry about it. Think about it. Okay, it's all good. Silence is okay. And we're going to read some of those off, okay? So put those in the chat. Rachel, thank you. Calm bodies. Take the good and throw the rest away. Thank you, Deborah. Hope is a discipline. I see you, Lauren. Everything is all right in the end. If it's not all right, it's not the end. Michelle, talk about it. The beauty of the butterfly is exemplified by her struggle. Yes, Jennifer, find joy in the journey. Okay, they coming through now. I'm trying to catch up with them. If I can't dance, it's not my revolution. I see you, Grace. We'll all work out. If you love what you do, you will never work a day in your life. Yes. This is the day that, let me get to you, Regina. This is the day that the Lord has made. I will rejoice in it. Casey, the capacity to love cannot be built in isolation. Yes. Tomorrow is always a new day. Darkness can't drive out darkness. Only light can do that. Hate can't drive out hate. Only love can do that. You all, thank you so much. Simona, a girl should be 2 things, who and what she wants. So as you all think about what we are facing, what you might be feeling, oh, those quotes are going to mean so much more, aren't they? The quote that I've been sitting on, and Jess, I want to get to you because you know, you in this too now. The quote that I've been sitting on is, there is no fear in love. There is no fear in love. It's a biblical scripture. When we love, there is no fear in that. So we continue to love. We continue to support each other. Jess, do you have anything you want to share? Yes, I'll put you on a spotlight, of course. You know me.
I was gonna do one of your quotes to me, but I'm gonna go one of our shared mentors, Delvery Blackwell, who constantly reminds us that what's for us is for us. What's meant for us will come to us, because it can feel like a lot of things are being taken, but just to have that faith that we're going to be okay. What we're working towards is not going anywhere. So that's what I'm reminding myself, that there are things out there that were meant for our beautiful group, and they're still there.
I love that. I've been telling myself that too. Yeah, that's a good one. All right, should we get into these questions, Jess?
Yes, let's do it. I love this moment, though. I could sit in this the whole. I mean, thank you everyone for these quotes. I'm going to copy this chat. I'm absorbing them all. Thank you for sharing the things keeping you going.
Absolutely. Thanks, y'all.
All right, we got to talk about Sawubona. It has been such an honor to see you bring your dream to life. You know, I've seen you in so many forms, but this is yours. This is something you've built in response to community needs and your passions. I would love for you to share with the group what Sawubona's core missions are.
Yeah, so Sawubona has 2 core missions, and that is to provide support, comfort, advocacy for birthing persons and their families in our community. And we also provide mental health first aid training. And so those 2 missions are so necessary in our community, as many of you may be in that same space. Many of you might know others who are in that space. Perhaps you support those missions, but those are our 2 primary missions. We focus on those 2 things.
And then I'm going to do the one word back at you. I'm going to do the because that I could. We always got to do the one word. Give me one word for Sawubona's impact that it makes with families, communities, Milwaukee, and beyond.
Yeah, I thought about this because there's so many words, but for me, power. For me, it's power, because when we are able to lift up a person's voice, not replace it, that's not what we do. When we are able to provide skill sets so that people don't feel hopeless or that they can't help people that they love, that's power. That's empowerment. We all deserve to feel some sense of power and control in our life. And so education empowers, and it's really empowering if we use it to help others. And so that's why I feel the work that Sawubona does is powerful. Yeah.
I enthusiastically agree. I know we want to have a few questions just to ground people in Sawubona, their mission, what they're doing, but I do want to let folks know that, you know, I'll start to welcome more questions in the chat. So if you have them, hold on to them for just a little bit while we learn the foundation of this beautiful organization. But know that you're going to get a chance to talk to Ms. Whitaker as well.
Absolutely.
I mean, talk to her all the time. So if you're like, wait a minute, why does Jess get to run the show? Know that I'm going to hand the mic over as soon as you get a chance to learn a little bit more. Let's talk about the creation of Sawubona. What motivated you? What's the origin story?
Yeah, thanks, Jess, for that question. Excuse me, my voice is not the best today, y'all, so I appreciate your grace. So I want us to do something together again. I want us to imagine us in this story, okay? I want you to imagine yourself in this story. Maybe you're the birthing person, maybe you're the provider, maybe you're the partner, maybe you are the nurse. Just imagine yourself in the story. Imagine what you might be feeling. Imagine what you might have done differently in this story, okay? So you are in the hospital. You are 6 centimeters dilated, 90% effaced. You are about to have a baby. You are about to give birth to a beautiful baby girl. 11 years ago, you did the same thing. So it's been a while, but here you are, nervous, excited, all the things that a birthing person should probably feel, right? But there is something wrong. The doctors and the nurses are fighting over your body. They're fighting over your body. They're telling you that the provider is telling you, you need to have this by C-section. You need to have your child by C-section because you had a C-section before. There's no medical reason why you have to have a C-section. That is a myth. But you don't know that, right? You're just the birthing person. You just want your baby safe. The nurses are saying you can have this vaginally, and they are upset. They are mad. And so now you're confused. You're afraid. There's a lot of fear involved. You are emotional, and you just decide the best decision that you can make. I don't want my uterus to burst because that's what you were told. And so you think about your child. That's all that matters. I want my child safe. So you have a C-section. Now, what some of us may not know is that when a woman has a C-section, you are cutting through 7 layers of muscle. It is major surgery. But there you are, and you hear your baby cry, and you know your baby is okay. But you don't see your baby for hours. Your baby's gone. You're laying there, you're in pain, you're confused. No one's telling you anything. How are you feeling? So finally you get to see your baby, and she is gorgeous. She is perfect. She is yours, and she is okay. You start to breastfeed her because breast milk is the best milk. Don't let them fool you. And your baby's okay, but you're not okay. Your chest is on fire. Your chest is in so much pain that you can't even laugh with those who are in the room with you. But you don't say a word. You pray that God will take this pain away because you have been taught that people don't believe your pain. So you say nothing. Fortunately, the pain subsides and you think you're okay, but you're not okay because you notice that your wound is not healing properly. And you tell 3 different providers that your wound is not right because you know your body, but they say you're okay. You're okay. You can go home now. But you realize that you are not okay. So you go home and you start to notice the wound is smelling. You have an infection. You call your doctor, you tell her what's going on. And by the way, these are not Freighter providers. This was not done at a Freighter hospital. I think that's important context. And she tells you, you're going to have to stop breastfeeding your baby. We need to get you on high dose antibiotics. And you don't know what to do. You tell her, what am I supposed to do? And she tells you, you need to get over it. And so you take the antibiotics and your wound starts to heal properly as your partner pours peroxide in this wound that was infected. There's nothing you can do about that, but wait. And so you heal. And after a few weeks, you're able to feed your baby again. You and your baby are okay. But when you think about what you had to go through to get there, what would you have done differently? How would you feel? I truly believe that if I had a doula present, I really believe this. Knowing what I know what doulas do now, we're going to talk about that. I believe our stories are glory, but I also believe that if I had a doula, that wouldn't have been my story. So I had to take this pain and turn it into power. To this day, when I tell that story, it is extremely difficult. To this day, I have physical manifestations of having a major surgery that I didn't have to have. Here's the reality. There are some birthing persons who will medically need to have a C-section. There are some situations that a C-section could be life or death for the mom or the baby or both. That happens. But in this case, that was not the case. So feeling helpless, feeling like I wasn't listened to, Women know their bodies. I thought to myself, I don't want anybody else feeling this way. So 12 years ago, the idea around becoming a birth doula was planted. My daughter was 2. She's 14 now, but she is part of the reason why. I don't want a birthing person to feel that way because they shouldn't feel that way. They shouldn't feel like they're not being listened to. And so that's the power of a birth doula. So the question becomes, well, what is a birth doula? There's various doulas, right? We have death doulas who work with people who are transitioning. But birth doulas provide comfort. They help provide birthing plans. They provide that advocacy that for some birthing persons, they need that. They go to the doctor with them. They are there during the birth and they are there after the birth. They visit their homes. They check on them. They check on them mentally. They provide practical help. And so that's the power of a birth doula. We know, thank you, Adrian. We know, and the research is getting more and more, I believe, aware of the impact of the presence of a doula. A birthing person is less likely to have a C-section. A birthing person is less likely to have an epidural. A birthing person needs that support and that dignity. I often liken to doulas as doulas are partners, not problems, when it comes to the healthcare setting. And Jess, you're involved in a lot of great work around this, so I honor you and your team, Dr. Anna Palatnik, Dr. Joni Williams, shout out to those amazing women, Dr. Dalvery Blackwell and her team. So we are making waves in terms of, changing how doulas are viewed in the healthcare system. They are partners, not problems. So that was my reason for becoming a doula. Unfortunately, a lot of women have that story, and we're just trying to change that. And we can. Many of us know the numbers. The infant mortality rate is extremely high in Milwaukee. Black women are 3 times more likely to die. 70% around that mark is preventable. Like, think about that number. So that's part of my why. My other why related to our second mission around mental health first aid training specifically, very personal too, right? So many of us who are service driven, it's tied back to something, right? That's what drives us when it gets really hard. And so for me, having lost family who have died by suicide, notice I didn't say commit suicide, died by suicide, who also struggle with mental health challenges. I have had my own struggles. I'm not ashamed of that. Having this skill set in our community is so vital. That is my passion. I will not stop until I continue to help people get these skill sets that they need. What mental health first aid does is it really helps us to understand the signs and symptoms. When someone is having a mental health challenge, we go through what that looks like. We honor what that looks like. We also talk about how do we help someone who may be having suicide ideation? How do we help someone who has a drug overdose? And so perhaps some of you on this call have taken it on the MCW campus. Shout out to y'all. It was a privilege that we were able to take this. And so I thought, wow, let's get this into our communities. So I became an instructor. It was a no-brainer for me. And just as you talked about, like, many of us have taken NCBI, many of us taken all kinds of trainings based upon our careers. This one for me, I'm a non-provider, so this one for me was one of the most powerful things. And I use these skill sets of being a birth doula, being a mental health first aid instructor, and a mental health first aid aider. So long story, but that is my why. That's what keeps me going when it gets hard, you know. The pictures that you all may have seen in the beginning, those were my extended family. Those were the babies that we serviced, that we cared for, that we held. So I'm so grateful to be able to be a part of people's lives in that way. It's truly a privilege. It's truly a privilege. Okay, I'm gonna stop talking.
You are not going to stop talking. I'm just going to give you another prompt, and then you're going to keep talking. But I want to honor a few things that you said, and I think that it is so valuable for others to hear. So many people will see someone like you, poised, confident, speaking in a space, and go, "Oh, everything must have always been perfect. Everything to get you." And so I think to share with others how pain became power. I think a lot of people sit with things and think they don't have that path to really do something. And I think that the way that you shared how you transformed that into what the communities you serve needs is beautiful. And I thank you for that. You also took a minute to honor my work. So, I'm going to turn it right around and honor yours. You did something when you were speaking. For a moment, you dropped some stats. And I was like, well, that's the thing, that's what I used to sit in. It's just those statistics. Black women are more likely to die. The way you frame it around a narrative, the way that you bring people into these spaces, the way that we're doing it with an upcoming video featuring doulas that we're going to show to everybody in the world so they can see exactly what these women do. People, we have dad doulas as well. I want to honor them. It's amazing. It is such a skill. And I'm so grateful that you help people like myself to stop just rattling off the statistics and connect to story. So thank you for both those things, my friend.
Appreciate you, Jess. Appreciate
Gonna
it.
dig a little deeper into you lifting
Let's
up birth
go.
workers.
Let's go. Yeah.
I know for a fact if you had yourself as a doula, because I've seen you in these spaces, that first provider would have heard from the very beginning. What do you value about other birth workers in Milwaukee, in the Madison communities? I know you've gotten to interact across multiple spaces. Do you want to lift up your peers in these spaces for a minute?
Yeah, absolutely. What I value about birth doulas in particular, because that's our focus. They love people. and they want to see change. And many of our birth doulas in our communities, they have families, they have full-time jobs like myself. And so this is their passion work. This is the work that they're committed to, despite all these other responsibilities that they have. They are resourceful. They genuinely care. They want to see sustainable change and impact. They are wise. They have so much wisdom. And again, the self-sacrifice that they bring is amazing, and it shouldn't be taken for granted. And that's, you know, just learning from them, and they are committed to getting better. You know, as a doula, there's always ways that we could have, things that we missed. It's a skill set that you have to consistently build on. And so having these community of doulas to support each other and to learn from is really beautiful. And it's a community. It's a small community. It's growing, but it's a community of doulas, and we're trying to break those silos. We know that Milwaukee is challenged by silos. It's not necessarily our fault. There's internalized oppression, all kinds of stuff that's related to that. That's another conversation, y'all. But, you know, we are trying to find ways, as you mentioned, Jess, collaborating, the maternal strategic action planning team, organizations across the country or across the state are coming together and finding ways to partner. So I really do appreciate that about our birth doulas in Madison and Milwaukee. Yeah, they're dope. They are dope.
They are. I welcome anyone to connect with doulas, support the doula community. Don't just show up, but like show up, take a doula to dinner, send a doula dinner. But spending 5 minutes with the doulas in these spaces is phenomenal. The way they connect is beautiful.
Mm-hmm.
All right. We saw your bio. We saw that you're also in radiology. You're solving the mental health crisis. You are a birth doula helping bring beautiful new life into the world and honoring birthing families. How do you do it? How do you balance it? That is so many things. You are addressing so many needs. How does it get done?
Yeah, you know, the $1 million question, can you have it all, y'all? Can you have it all? I think you can have it all within reason. I do. I think you could have it all within reason. There's so many of you that perhaps have passion work outside of your full-time job, the things that fuel you, your volunteers. I know a few of my friends are business owners, and they're doing it all within reason, but I do appreciate that they take care of themselves too. So specifically, what does Sawubona do? 3 things, okay? Number 1, we honor our client load, right? We recognize that we'll rather serve a few women than a whole bunch of women, and not the best way. So we're very intentional about not adding too many birthing persons to our load right now. And that's okay. That's okay, because I want to be the best birth doula I can be for someone. And not say I've serviced 50 women and I didn't do it well. I'd rather serve 5 and do it the best I can. So that's 1. We understand our limitations in that. Number 2, there is some sacrifice, right? There is some sacrifice there, but Sawubona also strives to be balanced in that too. So for instance, what could sacrifice look like? I recently did a mental health first aid training in the community focused on Black men, and that was held this past Saturday. It was a Saturday, y'all. Do you know what I like to do on Saturdays? I like to sleep, but because this work is so important, because I love it, because that's part of our mission, we do it on a Saturday. I know I can't do it on a weekday because I want to honor my full-time job. So there are times where Saturdays are not mine, but after it's done, the joy that I feel, the contentment, the peace of knowing that people have skill sets, I'll take that any day. So sometimes we're working on Saturdays. We're sending late emails. Jess, you have been a recipient of quite a few. And so there's that piece. But as Jai is about to share on the screen, listen, we get outside, Okay, we get outside. This is some of the things that I ensure that I'm a part of. And it's a hodgepodge of pictures, but to my left, that's my daughter, the 14-year-old state champions in hip hop. So we make space for that. Ironically, the weekend before, I was seeing a client. I was going back and forth to Menominee Falls, catching the dances, going to see my client, spending time with her and her baby and her partner and her dogs. And this was all happening in one day, literally in a whole morning. But it was love, right? Love fuels us. My daughter, who's in the circle picture, she's an amazing singer. Was able to go and see her perform. That is my bestie. And the rectangular thing, we're in Barbados. We live in our best life, y'all. And my younger daughter in the orchestra band. And these are some of my amazing friends my sister tribe, who we get together every year at the end of the year to reflect, to laugh, to cry. So we make space for self-care. And I think as people who are service driven, I think self-care is going to be so much more important than ever, honestly. So continue to take care of yourselves. But we find that balance, although it's not always easy. And there are moments where I'm like, what am I doing, Toni? But when I have those moments, I check in with myself. I shut down the laptop and I take some time to just enjoy life. So you can have it all within reason. You can have it all within reason, Jess. Thank you, Jai, for the slide.
And I think you are so good at boundaries and surround yourself with the best people. Everyone I meet through Toni.
Oh, absolutely.
The best person.
Yes, absolutely.
I want to do a quick check in the chat, I told the chat to wait. I said I had some questions to establish foundation. I have one more question that I'll ask now, and then I have one to close us out. But as I ask my next question, I want to welcome folks to throw anything that you want to, any direction you want to take the conversation in the chat. I'll be monitoring that. But you opened up 3 more questions with every beautiful thing you said. So I'll keep it going if folks would rather just sit and listen.
Yeah, don't be shy, y'all. Unmute or put it in the chat. Don't be
shy. I get to talk to Toni all the time. I'm going to text her after this and tell her how amazing she is. So don't let me hog the conversation here. Please do get in here. I know I actually see some folks. I see some folks who are in the nonprofit space. So I want to open up space for encouragement. What advice would you give, especially when organizations are newly established, discouraged by challenges? Any uplifting encouragement or advice for those folks?
Yeah, absolutely. Let me tell you, the nonprofit space is not easy. Let's be clear. So I liken this work. It's beautiful, but it ain't pretty. It's beautiful, but it ain't pretty. So creating a realistic view of this work is important. It's rewarding. Absolutely. You're serving people. There's no greater reward than that. It's to serve others. And raising canes. I think raising canes is a big word too. But other than that, that's my thing. But I would say get a mentor. Get a mentor. Find someone who's been in this space, who's willing to share their wisdom and knowledge. I want to shout out Marquesa at the African American Roundtable. She was an amazing mentor to me that I was introduced to by the amazing Najuri Jackson, who works here. And she just was a wealth of wisdom. She wasn't afraid to share. I think part of the struggles that nonprofits have, and what I was told, that Milwaukee has some of the most nonprofits in the country. And so it's a lot of us. And oftentimes you're fighting for grant dollars. And it's ugly. I don't want to fight. I don't want to fight. I don't want to fight for grant dollars. I don't want to fight any nonprofit. But it can become this scarcity mindset, which is not our fault. It's the system that we've been built in. And so it's recognizing that we can still support each other, even if we may not win that grant. I remember I've gotten no's on just about every grant that I've applied for last year. Not right now, this is what I'm calling them. And I remember one that really broke my heart. It was around mental health first aid training for Black men in the community. And when I tell you, getting that not right now was so hard for me. It was so hard. And, Jess, all about that. And so I had to just realize that, to your point, what's for me will be for Sawubona. and you just keep going. You know, you learn throughout the process, and you also be realistic. I had a lot of goals because my mind is like, let's get this work done. It needs to be done. What are we talking about? Right? Like, why are we not doing this work? But unfortunately, that's not how the world works. So I had to be realistic with our goals. And I just want to shout out my board, Jennifer Rogers, Amber Johnson, and Ayeli Tello. They all are involved in the community. They love people. I'm so grateful to them because it takes some time. You're building a foundation for your nonprofit. You're building a brand. You're building your name. And so be patient with yourself and try not to compare. One of the things that I didn't mention, Jess, is when you asked me, how do I, find balance with my full-time and with Sawubona, I don't compare myself to other birth doulas. That's important because it can be discouraging. Many birth doulas have full-time jobs. So we may have similar experiences and similar, circumstances, but we're all still very different. Some doulas' full-time work is tied to them being a doula. So they have opportunities to be more activated. Some doulas may have a better support system around them. I'm a single mom, right? I'm taking care of a household. And so I try my best not to compare myself to other doulas. Y'all know what I'm about to say about comparison. Anybody want to unmute? What does comparison do?
Thief of joy.
It's the thief of joy. Thank you, Sarah. So it's easier said than done, but I really do find that when I'm not comparing myself to doulas, I'm a more effective doula. Right? So that's another thing. But I kind of went on a tangent there, but if I can just summarize my own thoughts on that beautiful question. One, if you're a nonprofit, thinking about being a nonprofit, I have an amazing woman who works specifically with nonprofits. I can send the information, but seek a mentor, be patient with yourself, be realistic, and then just continue to create that foundation and believe that what's for you will be for you. And that partnership building, when it comes to nonprofits and grants, partnerships are so huge. Seek partnerships that you can trust and that you all can build a beautiful thing with. So those are a few of my thoughts.
Thank you. Now the chat is going.
Is the chat going? Okay,
the chat's going.
Should we pop in the chat?
I need to tell you that the phenomenal Simona Johnson is now asking about advice to explore entry into the doula space. So I would love for you to
Simona.
first. Then we're going to go to the policy question. So do you want to give advice to anyone exploring entry into the doula space?
Yeah, thank you, Simona, for that question. One, we need as many doulas as we can get. So, birth doulas, there's been a lot more talk around them. There's been grants that have been centered around birth doulas. Still so much more work to be done in that space. So, Simona, my meager advice would be, honor your why, and reach out to a doula. Have a conversation with a couple of them. What fuels them up? What are some of the challenges that they faced? How do they go about navigating the doula world? I would start there. I would start to talk to a doula and recognize that every doula is very different. So there's baselines, what doulas do, right? Creating birth plans, advocating for their patients, being there at the birth, providing those comfort measures based upon the needs of their birthing person, what they've desired. There's other doulas that may, watch your baby. They may come over and clean your home. That's very subjective, right? It's situational. Some people don't need that. It's interesting. My birthing persons, they were so self-sufficient. Like I would come over, do you want me to watch the baby? You want me to do the dishes? Like we good. We good, Toni. Just see how I'm doing and we good. So everyone's different. And when it comes to how you service somebody, but I would definitely, and I'm happy to talk, Simona. I'm a new birth doula, but again, that passion lived there for what, 12 years. And so happy to connect you with other doulas if you're interested. So just send me an email. Send me an email.
And I'll help you with this one. I don't know how much.
Oh, and Jess knows plenty. Yeah,
oh,
she
no,
knows
no,
more than I do.
I was talking about the next one. I didn't know, but yeah, obviously. No,
Yeah.
I love to be a connector. I sit in awe of every doula I've come in contact with. So if you just want to join the fan club with me, get on in here. And if you like writing grants about doulas, get on in here.
Yes.
Because yeah, that's support that's desperately needed. In most grant spaces, it's not the shortage of birthing people, it's the shortage of doulas. We eventually, and in some spaces, we operate at about a quarter of the need for requests for doulas. I was going to help with this next one. The next one is policy. So I know I'm sitting in that space a lot, but I'm going to throw the questions at you, but I'm going to throw you a lifeline depending. I don't know how involved you've been in these spaces, so I'm excited.
Not so much with policy, just in the conversations, but go ahead,
I'll
Jess.
ask the questions and I'll jump into two questions. How do you secure funding for doula? How do the doulas get funded? Any ideas how we can advocate for coverage for doulas to be a Wisconsin Medicaid covered service? Second question is, have you any involvement with Wisconsin policymakers on pushing the charge for billable insurance hours for doulas? I'll summarize it and I'll add too. And how do we get doulas paid? How are we currently getting them paid? How should we be getting them paid? Any thoughts? And I'm happy to share what I know about policy as well.
Yeah, Jess, definitely policy is more of your wheelhouse. Man, great question, y'all. Appreciate that. Yeah, the reality is like doulas is one of those services, like so many other services. We often talk about how teachers have never gotten paid what they deserved. So many service positions don't get what they deserve because there's so many things that you do. How do we get doulas paid? I know that's a conversation that's happening in the state. I think maybe just you can have more information on that. As we wait for legislation to change, many doulas do own their own businesses. Pay them what they're worth if you can, right? Like doulas often will take less because that's what we've been told that we deserve. And we don't. Some doulas who are starting off, they often will provide free services just so they can get that exposure, they can get that experience. We took a 5-month, very extensive training for the program that I was involved in with the African American Breastfeeding Network and Health Connect One. So it was a very extensive. It was the Saturdays for 5 whole months, and it was a lot. We learned a lot. So we bring a wealth of knowledge and skill set that deserves, recognition and honor through compensation. And so as Sawubona, we typically, what we're doing right now is we are asking people to pay us what they can because we want it to be equitable. Doulas aren't trying to get rich, but doulas deserve to get paid, right? If you provide a service, you deserve to get paid for it. So I think recognizing the power of what doulas do can help change the culture, right, of how doulas are perceived, which can help change if they get paid. So it's all about value, right? I'll give you all examples. So I called AT&T. I'm like, I need my bill to go down, right? So I'm like, I work for the medical college. I get a discount there. And then they're like, well, if you work in the healthcare fields, you can get a discount. I said, great. I'm a birth doula. And they were like, what? I had no idea what I was talking about. So she was like, are you a nurse or a doctor? Or I'm like, no, I'm a birth doula. I work with nurses and doctors. Can I get the discount? So they couldn't give me the discount, right? I'm just a birth doula. But it's again, and I think part of that too, to be honest with you all, I think right now there's no, birth doulas, the whole idea of being certified is a conversation. What does that look like? How do you regulate certifications of birth doulas? So that's a conversation that might be a barrier, and just happy to learn more about that from your knowledge in those conversations. But if you are seeking a birth doula, if you know people that might benefit from a birth doula, I think the best thing you can do is do your research and see what those impacts are, and then pay them what they are worth or close to it, and advocate for that. I'll advocate for that because doulas will accept less and just say, no, you deserve more. If I can give it, then I'm going to give it. And then also, donating to various organizations that support this work. There's always opportunity to do that. And maybe as an institution, some of those, we have huge campaigns with United Way, maybe highlighting organizations that support birthing persons and ensuring that they get some of those funds. Advocating for that in your donations might be a good place to start too. Does that answer the question? Because that was so long, but I wanted to.
It's a big complicated issue. I'll throw in there because I see people with a lot of different hats. So I'm going to try to call out a few other people with different hats, not by name. Don't worry, don't sign off. But I see researchers. I see people who write grants. The way that we get doula care to people who cannot afford to pay doulas what they're worth, and let's be honest, those are folks who need it the most. If you have significant barriers to care, is through our grant writing. So several of the grants that we currently hold are for direct services for doulas. The other thing that we do in the research community is that we look at the states that are actually providing Medicaid coverage, Medicaid reimbursement for doula services. California, Minnesota, New Jersey, Oregon, Indiana, Michigan, Oklahoma, Massachusetts, New York, and Washington, D.C. all do it. I looked that up. Don't be impressed. I couldn't remember them all, but there's many states that are doing this. So finding what we sometimes call our sister cities and showing the difference in outcomes in places with, I'm so sorry about my dog. I hope that's not coming through too much. Collecting the data. The other thing that I think we have to be really proud of here in Milwaukee is that we have one of two clinical trials under Dr. Anna Palatnik. We have the first clinical trial about doula care. So we're going to be able to actually have that impact, bring that to legislators, show them the amazing impact that doulas have. Really make that advocacy stronger by saying, look at how the outcomes improve. Look at how a doula, especially a doula getting paid equitably, look what she can do. They can do. Look what they can do. All the doulas I know are women. I would love to meet a dad doula. I know they're out there. I got to hang out with like Josh Liston or any of his cool folks. So those are the things I'll throw out there for the researchers. I mean, if you've had a doula, telling the story, bringing more people on the same page. And then if you're in an organization that can somehow support doulas, we worry about doula burnout. Average career of a doula is 2 to 3 years. I'm trying to talk fast. I don't want to be talking right now. But if you can be supporting a doula through whatever organization you're connected with, we have wonderful researchers. I see Dr. Chris Simmons on the call. He brought in a partnership with Nourish Milwaukee to provide food support for community-based doulas. Look at your assets, look at what you have, come join us, come to the table because there certainly is need. All right, I'm gonna go back to questions, but I think that policy one's a big one. I saw it a few different ways. Doula services are not currently covered by Medicaid in Wisconsin, but there are a few private insurers, so we're lifting those up as well. Dean Medical, I believe, is one that's all right, I'm gonna stop talking because that's not why folks are here. I am going to look at, let's see, Dr. Azam, Layla asked, how do you pair doulas with families since care can look different based on culture and faith?
Yeah, that's a beautiful question. Thank you for that. Many are our doulas, most of our doulas in Milwaukee are Black women who identify as Black women. And just correct me if I'm wrong, but I'm pretty sure I'm right about that. And so many of the families that we serve, we do have doulas who serve our Latino family. Nayeli, who's on my board, is an amazing doula who I trained with. She serves our Latino community. She is of that community as well. So we recognize that the commonality in culture and faith can make a huge difference. When we have this, unbalanced numbers as relates to representation in the birth doula space, we're working on that. I know AABN is working on that. It's about getting to know people, right? We're not going to know everything about everyone, but I think that's a beautiful opportunity. We try to be aware, not understand. Two different things. I won't be able to understand someone that has a different identity than me or a different experience than me, but I can be aware of their wishes and do the best that I can to support them. Right. So we service everybody. We service white women. We service everyone. It's not about just women of color. I think those are the women who are, when you look at the numbers, who are suffering the most, who experience social determinants of health at a greater rate. But we know that, an adverse birthing experience can happen to anybody. And so our role as birth doulas is to get to know your wishes as much as possible. And at any given moment, you can say, you know what, this isn't the right fit for me. I've had that happen. I remember someone mentioned to a friend that I was a birth doula, and I met them out, and they were a pleasant couple, and it was their first child. And I had mentioned that I'm going to be traveling, right? And so first child, I wasn't traveling on their delivery date, but I was traveling too close to their delivery date. And so they're like, yeah, this isn't going to work out for us, because they had that concern. And that's okay. That's okay. So what we do is one of our main focuses is that relationship building. We want to get to know your story. And that's why you'll hear that doulas can spend hours with someone in one visit. The visit that I had a few weeks ago with my birthing client who had her little boy, I was at their home for more than 2 hours, just talking, getting to know the dogs. Like, we were just hanging out. And so I think that's the best way we can do that, as we continue to, welcome other people who want to be doulas in this space that may not be Black women. Does that answer your question?
No, I think beautifully. And I will say, knowing we have our organizations and our partnerships that Toni and I sit in do focus predominantly on Black birthing women. Because of the startling disparity, we're proposing programs. Now we actually trained our first Hmong doula, and we're proposing programs where we expand our model, not necessarily trying to be everything to everybody, but to have champions and people who want to start their own nonprofits in the Somali, the Hispanic, the Hmong, and there's one more, I forget who the other one that we have. And then in our tribal communities. So we're trying to kind of build our model out so that culturally tailored care can be provided to more than one community.
I know we got to close, Jess.
I got two more.
I want to, you got two more? Because I'm looking at Jessica's, because I really love this.
That's where I was going. Okay, you were there. That's where I was going. I was like, I got to get that one in. So, okay, let's go to Jessica Franco Morales' question. What are some skills, technical, soft, that you feel were the most helpful in building your organization and making an impact? I'm sorry to the ones we won't get to. You had to get that one in for sure.
Yeah, and Rachel, I want to honor your story too. So thank you for sharing that. I think really quickly, that's what we're working on these videos about, like the impact of doulas. It's a UPenn project that Jess is spearheading, and we're working with other doulas to get that word out. So to your question, thank you for that. But Jessica, really quickly, it's interesting for me, because skills, for me, it's all about the why, right? I think skills are important, but when it comes to this work, mental health, first aid, and birth doulas, I think it takes a great deal of humility, because we can come in thinking that we know what people need, but it's really about listening to them. So being very intentional about listening, humility. And I like in the doula work, we're in the background. We're in the background. We only come out when we are needed. And for me, that takes a great deal of humility. Every situation is different. And so ensuring that you are giving each one the floor to share what they need and want is so important. We talked a lot about doula work, but mental health first aid is very similar. As an instructor, I'm just an instructor. I'm living in this work all the time. I'm seeing the challenges that I have. And so this idea of constantly learning is so important too. So yeah, I would say those things. Yeah. I know we got a couple of more slides. Thank you all. This was so good. I was telling people, I'm so nervous, this introvert of mine. But I know we got a couple of more slides before people head off. So thank you all so much for your beautiful comments and your questions. I appreciate y'all. A couple more things though.
And I was trying to help real quick. I got the wrong Emily. There is an Emily in Green Bay, and I've met her like 3 times. But for Rachel, there is a amazing contact in who has. So let me get that to you, Rachel, because there is somebody who might be good to talk to. All
Thanks.
right. The question I want to make sure we get to before we wrap is how can we support Sawubona? So why don't you take that one to wrap us up?
Yeah, we need the support. You know, we offer these things, a lot of it on our dime, and we know that that's not sustainable. So if you click that QR code, or I think we're going to get the video recording too, please donate. And you are able to select what you want to donate for. So specific things, maybe you want to donate to somebody to attend a mental health first aid and get their certification. Maybe you want to donate to this birth worker experience that we're working on with birth workers throughout the city. Maybe you just say, hey, Toni, here's $25, do what you want with it, you know, anything that's going to support our work. So please, we appreciate anything you can contribute, but I want people to really see where their money is going to. So you have the power to decide where that's going. So I appreciate y'all so much. Yeah.
And I know we're at time, but you can talk to Toni and I anytime. We love talking about this. This is our passion project. I want to thank you all for joining us today. We're going to post the recording. Thank you for being with us. I think we highlight the next one coming up. Oh, get the QR code, Sawubona. So you still have I've got 5 on it. Campaign going.
We're kind of replacing that now. We're kind of replacing that now.
I've got 500 on it. Like let's grow it even bigger. But please join us in February for the next spotlight session. Thank you for being with us. I needed this positivity. I'm sure a lot of folks did too. Toni, thank you for who you are.
Appreciate you. Thank you, Jess. Thank you, everybody. Remember those beautiful quotes. Those beautiful quotes.
I'm saving the chat. There's so much good in here.
Yes. Do something good for yourself today.
All right. Take care, all.